The theme of the Victorian Seniors Festival this year is Connect, Create and Celebrate. And that's what this show is all about. Connect with hobbies you may not have done for years. Create new hobbies and activities to get into. And celebrate. Keep a positive attitude to aging and keep having fun. I'm Carol and welcome to Over 50 So What? Getting diagnosed with cancer is a challenging time for you and your loved ones. We have a chat to Dr. Rachel Cameron, who has some resources to help you navigate this difficult time. Connect, create and celebrate. One hobby you might want to pursue further is photography. And we find out more about U3A network photography groups who cater for beginners to the more advanced. And don't forget to celebrate by doing the fun 5-minute fitness routine after the break. You can do it sitting or standing. It's estimated that 88% of all cancer diagnoses are in Australians over the age of 50. Most of us are not ready for a diagnosis, but there are resources to help you. And today we're speaking with Dr. Rachel Cameron, author of You've Been Diagnosed with Cancer, Now What?
I'm delighted to be here, and I wrote this book, You've Been Diagnosed with Cancer, Now What?, which you can find the link on my website, but it's also on Amazon. I wrote it as a tool because what I found with people when they first get diagnosed, they get hit with a lot of information. It's very confusing. I got it written or printed on matte paper so that you can write in it. You can have your doctor write in it, so they can draw pictures depending upon where your cancer is. It's got tables in it, so you can put all the numbers of your doctors or your healthcare professionals in it. There's blank pages so that you can keep notes, and that can be helpful when you're being bombarded with a whole heap of information. Unfortunately, the doctors see a lot of patients, so sometimes they use big words, they're confusing, so I put a little index in the back to explain some of the big words.
So that's a fantastic resource for people to take into their GP to help them, because they're in shock. It's in a highly charged emotional state.
Yes.
Have you got any tips on how to handle that charged emotional state when you first get diagnosed?
Take a deep breath, keep breathing deeply as much as possible, and try to stay calm. Now, if you do need a break, it's important to tell your clinician that. Lots of people do cry at the time of their diagnosis. They're very upset, they're in shock. So anything to calm yourself down.
Now, what about friends and family members? If their loved one's just being diagnosed, what are your tips and advice for them?
Yes, look, I think both the person who's diagnosed and the family need support. So there's different groups and resource teams to help the family member and the person with the cancer diagnosis. Many people try to stay brave, and stiff upper lip, but often just a matter of crying if you need to, or being as honest with yourself and the family member as possible. So if you are struggling to cope, it's important to either ring Lifeline, Beyond Blue, cancer councils, have a counsellor If you don't already get one, you will probably need one, because the cancer journey is a roller coaster.
What about the person that's trying to support that person? They'll be going through a lot of those things.
They need all
as
those
well.
things as well. Yes, so they can ring Cancer Council, they can ring Beyond Blue, they can ring Lifeline, they can speak to their own counsellor separate to the family member who's got the diagnosis. And that's very important.
Yes, you want a strong support team around you that's providing the right support. And I know that a lot of the family members do fall apart.
Yes, absolutely. And it is really stressful. And so with my cousin, we were supporting him for 9 years. When he first got diagnosed, they said he was 27. Sorry, you're going to only live for 3 months. Go away. And I said, no, let's get a second opinion. He did pass away after 9 years, but he lived for 9 years because we got a second opinion versus 3 months.
Yeah, so it's all about being proactive and like you said, second, third opinion, even.
As many as you need. There are other choices and options. There's things like clinical trials. You can choose no treatment. That is your right. That's up to you. If you want to do acupuncture or other alternative therapies, that is your right. You can do that. It's your body. It's your diagnosis.
The other thing you said is a lot of people assume that all cancers are equal.
No, they're not. Some cancers are much easier to treat than others. So solid tumours, so the ones I mentioned, are often a little bit easier in the sense that if you get them earlier, you can get surgery to cut it out as an option, whereas a blood cancer, they have to treat all the blood.
Can you talk us through the level 1, 2, 3, 4?
So there's different stages of cancer and categories. So staging is related to where the cancer is in terms of spreading. So like if I simplify it, if you have a solid tumour and it's say it's a breast, it's just a small lump in the breast, that would be a 1, but then if it starts to move into the lymph node, so for the breast there's a little lymph node under the armpit, if it starts to move into the lymph node, that's going to be a 2, and then as it goes out of the lymph node and into the rest of the body, and the spreading of cancer is called metastases, that's the term for it, means spread, then it goes into stage 3 or 4.
And the idea is to catch it before it gets to stage 2, get it at stage 1.
Correct.
What's in the book when someone just gets diagnosed? What's the best page to go to straight away?
Probably the most important page on the book is don't Google, because what people do is they put in the name of the cancer that the doctor told them, and then they look it up. And then they go, what's going to happen to me? What are the symptoms? But what Google doesn't take into account is your age, the stage, your environment, all the other things, the pathology. So it can really scare people looking at Google. One of the things I did, probably the next page that would be good to look at, is what I call your recovery checklist. It's got some simple questions for you to ask yourself. Have you done these things? Then I have another checklist when you're in front of the clinician. Do I understand what he's saying or she's saying to me? And it's got a checklist. So you can take this in to your appointment and help you check, because often they're very busy and you've got a lot of emotions and thoughts going through your mind, so you might forget things. So this helps you in the appointment.
Yeah, absolutely. So do you recommend that you take someone with you to the appointment?
Absolutely. Now, you may take your family member, but remembering your family member is probably not coping with your diagnosis either, and they may not be the best person because they also are stressed. I mean, you can definitely take your family member, but it's often very good to take an independent advocate who can ask you questions and ask the doctor questions to make sure everything's covered.
Thanks for your time today. It's an amazing resource to have when you're just totally swamped in that emotional state and it's all a whole new area.
You're welcome.
Thanks for watching our TV show. Be sure to hit subscribe and then you'll never miss an episode. Jump on Facebook, join our group, get in on the fun, fitness, wellness and inspiration. I'm Carol, over 50. So what?